Hi everyone, I'm Dr. Sherry, Chief Medical Officer of Women's Health at QuickMD. Today we're talking about estradiol combined with norethindrone, a hormone therapy many women use during perimenopause and menopause. Today we'll walk through what this medication is, how it works, who it's right for, what benefits to expect, and how to use it safely. Let's start with the basics without overcomplicating it. Estradiol plus norethindrone is a combined hormone therapy pill all in one. It's designed for women who are in perimenopause or menopause, still have a uterus, need uterine protection, and want estrogen symptomatic relief. Estradiol restores estrogen your body is no longer making, and the norethindrone protects the uterine lining from overgrowth when taking estrogen. You may wonder, what is the difference between norethindrone and progesterone? Believe me, it is confusing. But norethindrone is a progestin. It is not a bioidentical progesterone, but it's very effective in protecting the uterus when using estrogen. Is this a birth control, you may wonder? Using estradiol with norethindrone is not a birth control pill, but will help with hormonal symptoms caused by perimenopause and menopause, but it will not protect you against pregnancy. So it is not a birth control. Now let's talk about some myths and misconceptions. Here's a common one you may see on the internet. If I'm not bleeding anymore, I don't need progesterone. So here's the thing. If you have a uterus and take estrogen, you still need protection, bleeding or not. Another is combination therapy is only for severe symptoms. Hormone therapy is about comfort, sleep, functioning normally, and long-term health. Whether you have mild or severe symptoms, combination therapy can be beneficial to improve your overall well-being and quality of life. So what does this medication actually help with? For many women, the biggest improvements are actually in resolution of hot flashes and night sweats, sleep quality, mood stability, vaginal comfort, mental clarity. And a lot of women will tell me that they don't feel fixed, but they definitely feel more like themselves again. Estradiol plus norethindrone often works well for women who want an oral medication, prefer one pill instead of multiple prescriptions, are in early menopause or in perimenopause, and have bothersome symptoms but want a more straightforward approach. It may take a few weeks for symptoms to improve. For some, it may even take a couple months. If nothing improves after 3 to 4 months, that's a sign to speak to your doctor to reassess your medication dose or your treatment plan. Some women ask if estradiol plus norethindrone helps with irregular bleeding or causes more of it. Light spotting is actually very common in the first few months when starting this medication. Your uterus is adjusting to a new hormone environment, and that adjustment doesn't mean anything is wrong. Now, heavy bleeding or bleeding that doesn't settle down over time is when you need to take a closer look with your healthcare provider. This medication is usually taken once daily around the same time. Consistency is more important than perfection. Most women start with a low-dose form of this combination pill, but if symptoms persist, this dose can be increased safely. Needing a higher or lower dose is not a reflection of your health. It's just individual needs and, of course, your biology. You'll want to avoid skipping days, stopping suddenly due to spotting, and taking extra doses to catch up. If you miss a pill, take it when you remember, unless it's close to your next dose. One of the first questions I usually hear is, can I use vaginal estrogen if I'm already taking estradiol and norethindrone? And the answer for the majority of women is yes. This pill works throughout your whole body, but vaginal estrogen works locally just inside the vagina. So if dryness, irritation, or painful sex is still an issue, adding vaginal estrogen is often completely appropriate. Another really common question is, what if I'm already using a patch or a gel? Can I switch to this pill? And certainly you can. A lot of women move between different hormone options over time to find just the best one that works for them. Sometimes it's about convenience. Other times it's cost. Sometimes your body just responds better to one form over another. At some point in every conversation, somebody asks, but what about the risks? And that is definitely an important question. For most healthy women under the age of 60 or within 10 years of menopause, risks generally are very low. But possible risks include things like blood clots, stroke, breast tenderness, or headaches. What matters most here is that your risk is personal and has to be discussed with your healthcare provider. Your age, your health history, your family history, and lifestyle all play a key role. This is why hormone therapy is very personal and individualized just for you. I also get questions like, what if I have fibroids? Or what if I had endometriosis? In many cases, women with these kinds of medical conditions can still use hormone therapy safely. But it does mean we need to be thoughtful about your dosing, monitoring, and close follow-up. Now, there are situations where estradiol plus norethindrone may not be appropriate. That includes women with a history of estrogen, sensitive cancers, certain clotting disorders, active liver disease, or uncontrolled high blood pressure. And this is why it's so important not to start hormone therapy without medical guidance. I also want you to know when to reach out to a healthcare provider. So if you notice new or heavy bleeding, chest pain or shortness of breath, severe headaches, leg swelling or pain, or new breast changes, this would be the time to discuss these symptoms with your healthcare provider. Of course, these symptoms are very uncommon, but should be evaluated promptly. Estradiol plus norethindrone can be simple and effective in managing menopausal or perimenopausal symptoms while protecting the uterus and helping get relief from disruptive perimenopausal and menopausal symptoms. The most important thing is making sure your hormone therapy works with your body and your medical history. Thanks so much for spending time with me today.